A luxury expedition cruise sailing across the South Atlantic has suddenly become the center of a growing international health investigation. What began as an isolated medical emergency aboard the MV Hondius has now escalated into a multi-country public health response involving Europe, Africa, and global disease experts. 3 people are dead. Several others are sick. Passengers have been medically evacuated across continents, and authorities are now tracing travelers who left the ship before the outbreak was fully understood. The situation has drawn worldwide attention because the illness involved is Hantavirus, a rare but potentially deadly disease most people have never heard of. Now, health experts are racing to answer one major question: how did the virus spread aboard the ship, and could rare human-to-human transmission be involved? The outbreak has triggered concern, confusion, and a wave of speculation online as officials work to contain the situation without causing panic. Here's everything we know so far. The outbreak centers around the expedition cruise vessel MV Hondius. The ship is operated by Ocean-Wide Expeditions and was traveling through remote regions of the South Atlantic. During the voyage, multiple passengers began showing signs of illness. At first, the cases appeared isolated, but the situation quickly intensified. Authorities now say at least 8 hantavirus-related cases have been identified among people connected to the ship. 3 cases have been confirmed through testing, and 5 others remain suspected cases. 3 people linked to the outbreak have died. One of the earliest deaths involved a Dutchman who died aboard the vessel on April 11th. His wife later disembarked the ship at St. Helena, carrying his body. She then traveled onward to South Africa. Days later, she collapsed at an airport in Johannesburg and died. Another fatality involved a German woman aboard the ship who reportedly died on May 2nd. Her body reportedly remains aboard the vessel, as per reports. As concerns spread, emergency evacuations began. A British passenger was evacuated from Ascension Island. 3 additional people, including the ship's doctor, were later airlifted to Europe for medical treatment. Those evacuees included British, Dutch, and German nationals. Authorities say some evacuees are showing symptoms consistent with hantavirus infection. However, not all have tested positive. The ship itself spent several days anchored near Cape Verde as officials assessed the outbreak. It has since resumed sailing towards Spain's Canary Islands. Spanish officials say everyone arriving aboard the ship in Tenerife will undergo medical assessments. More than 140 passengers and crew members remain aboard under strict precautionary measures. Health authorities say the ship currently includes travelers from over 20 countries. That international passenger list has complicated the response effort significantly. The World Health Organization has also confirmed a man who had traveled back to Switzerland after disembarking the ship tested positive for hantavirus and is receiving care at a hospital in Zurich. Meanwhile, KLM Airlines confirmed that one infected traveler briefly boarded a flight from Johannesburg to Amsterdam before crew members prevented further travel due to her worsening condition. Hantavirus is not a single virus. It refers to a family of viruses primarily spread by rodents. Humans usually become infected through contact with infected rodent urine, saliva, or droppings. The virus can become airborne when contaminated particles are disturbed and inhaled. People cleaning enclosed spaces with rodent infestations can unknowingly expose themselves. Rural farming activity can also increase risk. Sleeping in rodent-infested cabins or buildings has historically been linked to outbreaks. Most hantavirus infections are considered rare, but severe cases can become life-threatening very quickly. Some strains can cause a condition known as hantavirus pulmonary syndrome, or HPS. That illness attacks the lungs and respiratory system. Early symptoms can resemble the flu. Patients often develop fever and fatigue first. Muscle pain is also common. Headaches and dizziness may follow. As the illness progresses, breathing difficulties can rapidly become severe. In critical cases, patients can experience respiratory failure. As news of the outbreak spread online, social media quickly amplified public anxiety. One viral discussion centered around an old social media post from 2022. Users resurfaced screenshots from an account that posted the message, in quotes, 2023, Corona ended, 2026, Hantavirus. Some users claimed the outbreak somehow validated the prediction. One tweet dated May 1st, 2012, went viral, which said, "Overheard behind me while watching H5N1NAS workshop today. You want to really make a pandemic, make hantavirus human transmissible." Others suggested darker conspiracy theories. However, there is currently no scientific evidence suggesting the outbreak was planned or engineered. For now, the MV Hondius continues its journey toward the Canary Islands under intense international scrutiny.
So far, 8 cases have been reported, including 3 deaths. 5 of the 8 cases have been confirmed as hantavirus, and the other 3 are suspected.
Executive Director for WHO's Health Emergency Program. And last but not
WHO is aware of reports of other people with symptoms who may have had contact with one of the passengers. In each case, we're in close contact with the relevant authorities. Given the incubation period of the Andes virus, which can be up to 6 weeks, it's possible that more cases may be reported. While this is a serious incident, WHO assesses the public health risk as low.
2 things. First, please identify yourself clearly. We will not be able to take any.
A WHO expert boarded the ship in Cabo Verde and has been joined by 2 doctors from the Netherlands and an expert from the European Center for Disease Prevention and Control, who will stay on the ship until it reaches the Canary Islands. They're conducting a medical assessment of everyone on board and gathering information to assess their risk of infection. WHO is developing step-by-step operational guidance for the safe and respectful disembarkation and onward travel of passengers and crew when they arrive.
To Tenerife in this weekend. If I may, I have a second question.
Prior to boarding the ship, the first 2 cases had traveled through Argentina, Chile, and Uruguay on a birdwatching trip, which included visits to sites where the species of rat that's known to carry Andes virus was present. WHO is working with health authorities in Argentina to understand the movements of the couple